Hello everyone, I'm Vinoli. Welcome back. Today, in this video, we are going to discussing about care of IABP, intra-aortic balloon pump. Before we start, I would like to tell you that overview of the topic. Introduction, purpose, indication and contraindications, physiological effects of IABP therapy, and a catheter and kit content, equipments, steps of IABP insertion, and inserting balloon catheter, and positioning during the IABP, and finally coming to the nursing care, pre-op and post-op nursing care during the IABP. What is IABP? IABP gives temporary support for the left ventricle by mechanically displacing blood between the aorta. So it is the most common and widely available methods mechanical circulatory supports. Traditionally, which is used in surgical and non-surgical patients who have with cardiogenic shock. History. In 1958, Horkan described a method to treat left ventricular failure. In 1979, after subsequent development, a percutaneous intra-aortic balloon with a size of 8 and 5 to 9 and 5 French was achieved. In 1985, the first pre-folded IAB intra-aortic balloon was developed. So, today continued improvement in IABP intra-aortic balloon pump technology permitted safer use. Coming to the purpose, the primary goals of intra-aortic balloon pump treatments are to increase the myocardial oxygen supply, to decrease myocardial oxygen demand, improvement of cardiac output, and increase of coronary perfusion pressure. Indications. Intra-aortic balloon pump therapy is used to treat cardiogenic shock. That's when your heart cannot pump enough of blood to meet the needs of your body, so the IABP intra-aortic balloon pump is required. Some heart problems can cause cardiogenic shock. So this includes like unstable angina, heart attack, certain abnormal heart rhythms, heart failure, and heart defects. And you may also need an IABP if you have a certain medical procedure like perioperative treatment of complications which is due to myocardial infarction and as a bridge to cardiac transplantation. We'll see physiological effects of IABP therapy. Intra-aortic balloon pump inflates at the onset of diastole and deflates just before the systole. These magnitudes or effects depends upon the balloon volume, heart rate, and aortic compliance. What is inflation and deflation? Inflation and deflations are synchronized to the patient cardiac cycle. Inflations of the balloon causes an augmented diastolic pressure, and deflations of the intra-aortic balloon pump reduces the left ventricular afterload. So here you have the picture. You can see intra-aortic balloon pump during systole and diastole. We'll see intra-aortic balloon inflation to diastole and deflation to systole. Inflation to diastole is augmentations of diastolic pressure which is increasing the coronary perfusion and increasing myocardial oxygen supply. Whereas the deflation to systole is decreasing the afterload and then decreasing the cardiac work and decreasing myocardial oxygen consumption and decreasing the cardiac output. Coming to the contraindications. Some people are not good candidate for an IABP, including those with significant aortic regurgitation, aortic dissection, aortic stents, bilateral femoral popliteal bypass graft for severe BVT, and abdominal aortic aneurysm, uncontrolled septicemia, uncontrolled bleeding diastasis, and severe bilateral peripheral vascular disease. Next, we'll see IABP counter pulsation system. So here two principal parts we are using. One is the flexible catheter to lumen and mobile console. What is flexible catheter to lumen? Here it is the first step is for distal aspiration, flushing or pressure monitoring, and the second step is for the pediatric delivery and removal for helium gas to closed balloon. Whereas the mobile console, here the system for helium transfer and the computer which is used for controlling the inflation and deflation cycle. So these are the two principal parts which is using the counter pulsation system. So this is the IABP machine. Next we see about IABP catheter. So the catheter is 10 to 20 centimeter long polyurethane bladder will be there, and also which is have the 25 cc to 50 cc capacity. And then soft balloon catheter contains there are two lumens. One is allows for gas exchanges from console to the balloon. The second lumen for catheter deliver over a guide wire for monitoring of central aortic pressure after the instillation. Next we'll see IABP kit content. First one is introduce a needle, guide wire, vessel dilators, sheath, IABP for 34 or 40 cc, gas tubing, 60 ml syringe, and 3-way stop cock, which is IABP kit content. So this is all which is using for IABP monitoring. Let's see what are the equipments required for during the cardiac catheterization. So the following equipments and associated supplies be on hand when performing cardiac catheterization to treat ventricular arrhythmias or other complications. So we'll see one by one. One is resuscitation bag, oxygen, suction, oximetric device, endotracheal tube, and defibrillator, monitoring for pulse and blood pressure, ECG, external pulse pacemaker, medications such as iodine, betaline, and epinephrine, atropine, morphine, and isopretinodone. Steps of IABP insertion. First, we have to connect the ECG, set up pressure lines, and femoral axis, which is followed by insertion of the supply sheet and 0.030 inch supplied J-shaped guide wire to the level of the aortic arch, IABP insertion. So first, before taking the catheter out of the tray, we have to aspirate at least 30 cc. Then take the entire catheter and T-handle as one unit. First, do not disconnect one-way valve when removing the extracorporeal tubing from the tray. And the next step is pull out the T-handle only as shown. So next we'll see how to inserting the balloon catheter. First, removal of the stillet, aspirations and flushing over. So after that, inserting the balloon only over the guide wire. Then hold the catheter close to skin insertion point, and next advance in small steps of 1 to 2 cm at the time of stop if any resistance. The IABP should advance freely inserted. Many vascular complications occurs during the insertion itself. So that is resistance during the insertion, either the indications of the PVID or dissection. So kinking of IABP improper may be the inflation and deflation. Coming to the positioning. After inserting of the catheter, we have to see the IABP catheter whether it is in the position. The end of the balloon should be just distal 1 to 2 cm to the takeoff of the left subclavian artery. How we have to check the position? The position should be confirmed by fluoroscopy or chest X-ray. On the chest X-ray, the tip should be visible in the second and third intercostal space. Place the patients in the supine position on the tilt-to-top table and secured by the restraints. An ECG leads to be placement for continuous monitoring. The patient may be asked to cough or deep breathing, and monitoring the patient's heart rate and rhythm, respiratory and pulse rates and blood pressure, which is all frequently during the procedures we have to monitor. Coming to the complications. IABP therapy can be very helpful and it can sometimes even be life-saving also. But it does have some risk. So this includes lymph ischemia, which is damaging of the lack of blood flow to the lymph, and low platelet count, and which might cause excess bleeding because your blood does not clot as well. Another complication is bleeding from the site and internal, and thrombosis, aortic valve rupture, and incorrect positions of the balloon which might cause injury to the kidneys or other problems. And finally, infection and sepsis. Coming to the triggering modes. So there are 5 triggering modes which are used to trigger the console. The first one is ECG. So which uses the slope of QR segments to detect the triggering point, and AP, atrial pressure wave, the systolic upstroke the atrial pressure wave from the trigger, and internal trigger, pacer and pacer with AV. Troubleshooting. The following are common problems that may occur when using the IABP. So first one is no trigger. So this means that the IABP has lots of tracing of ECG or pressure and it is unable to time to inflation and deflation. So that what action we have to take? So the first to reconnect the ECG leads or pressure capable, or change the ECG leads or tracing leads to obtain the better trace. And next, check the IABP catheter. So this means that the IABP catheter is either kinked, institute or insertion sites, or it has not unwrapped fully institute. So what action we have to take? Here the examine the catheter and extension tubing for any signs in kinking and ensure that full augmentations is on making sure the balloon has the ability to expand, and examine the skin insertion as this is a common place for kinking. Rapid gas loss. This will appear if there is a leak or hole in the balloon or extension tubing. So this means the balloon may be ruptured. You will see flash blood between the tubing. So what action need to be taken? If the balloon is losing its gas and filling is frequently necessary, or blood flags have been identified in the tubing, then immediately we have to stop the pumping. It will means that the catheter will need to be removed and replaced. So finally check the all connections for any leaks and disconnection. IABP disconnector. This means the IABP catheter extension tubing has been disconnected and the pump will be stopped working. So what action need to take? Reconnect the extension tubing, press IABP fill for 3 seconds till prompt is one of the screen and press assistant. Stand by the start pumping. Coming to the nursing care. Before the procedure, we have to explain to the patient. So first obtain the informed consent. After the patient is probably identified, the procedures must be explained before consent can be signed. And monitoring the vital signs. Baseline vital signs will be done, and as long as this or the doctor's interest can proceed with the procedure. And the blood test must be done, including blood, urine nitrogen, creatinine, PTT, INR, insulin and sugar levels. And finally, obtain the client's height and weight, which will help you for used to determine dye administration. Fluid restrictions followed by 4 to 6 hours. Here, ensure that dietary and fluid restrictions have been followed at least 4 to 6 hours before the study. And after that, medications are restricted or discontinued. So here, ensure that the routine medications are restricted, or which is allowed to permissions from the physician, in order to that is for who is taking the anticoagulants medicines have been discontinued. Site should be shaved and cleansed. So here, anesthetize with the local anesthetics agents that the catheter is inserted, the sensation experience as the catheter is advanced. So after that, have to collecting the allergy history. So asking the client about any history of allergy like iodine based contrast agents. So next, to provide the hospital gowns without metallic closures. And after that, allow the client to retain the dentures, glasses and hearing aids, so which is all as they do not interfere with the study. Obtaining the baseline pulse, blood pressure, ECG and peripheral pulses, which is all mark the sites of peripheral pulses for comparisons of after the study. And after that, administering a sedative or anti-anxiety agents such as diazepam. So another name is Valium, or both types of medications and analgesics such as mebriprine, other name is the Demerol. So this is all medications ordered before the procedures, 30 minutes to 1 hour we have to give. Initiate an intravenous line to administer fluid and medications. So this is all needed during the procedures. Have the client wait before the procedures and obtain the history of suspected of known cardiac conditions like any cardiovascular status or any cardiac medications like allergies to iodine and previous test and any procedures.
That's today. Hope you like this video. Thanks for watching.